Scleral contact lenses have changed the lives of many patients who require contact lens wear to function due to their ocular condition. There are also many patients who simply prefer contact lenses as compared to glasses. The ability to apply, remove, and properly care for these lenses are a little different than other lens types that you may have worn. The purpose of this slideshow is to provide general information concerning your scleral lenses. We will discuss lens application, some aids that are available that you may find useful. We will discuss lens removal techniques, and finally, some care system considerations. Excel Specialty Contacts is a proud sponsor of the Scleral Lens Education Society. This nonprofit organization offers education to both patients and eye care professionals concerning scleral lenses. There are a number of patient resources available to you free of charge that you might find helpful. The web address is www.sclerallens.org. Let's start with lens application. Any of the information provided in this presentation is intended to be only a general guide to help you with your scleral lenses. Always follow the directions given to you from your eye care professional, as he or she is more aware of the specifics of your eyes and your lenses. Some of the images used in this presentation are done so with permission from the Scleral Lens Education Society. Most patients find it best to use the right hand to open the right eye and the left hand to open the left eye. One of the keys is try to leave both eyes open wide. Although you are only applying one lens at a time, the fellow eye being closed will often cause the lids of the eye you are applying the lens to become less wide. Attempt to round the eye open by using your thumb and forefinger. Holding your lid margin against the bony orbit of the globe will help you overcome the natural reaction of closing your eye. With time, practice, and patience, you will probably develop your own way of application that works best for you. The scleral lens must be applied to the ocular surface completely full of the recommended solution. Your face and chin should be in a downward position in order to apply your lens full of unpreserved saline solution. Never use a solution for application that contains preservatives and other ingredients. Your eye care professional may also suggest you use a more viscous, unpreserved artificial tear as you learn how to properly apply your lenses. If you apply your lens less than full, an application bubble will result. Any air bubble under your lens will impact your vision and comfort. In order for large bubbles to dissipate, you will need to remove the lens, refill, and reapply properly. A number of years ago, Dr. Ed Bennett suggested the use of an ordinary O-ring found at any hardware store as an aid for scleral lens application. Most patients use the DMV suction device, and that is what we use and recommend as well. The DMV suction device may be cut to a shorter length that also results in an opening that you might fixate on as you apply your lens. This is especially helpful for patients who are nearsighted in order to maintain fixation on the light through the opening. Although we recommend the DMV scleral suction ring, another tool you may consider is called an Easy Scleral Lens Applicator. This product can be found online at ezibyqcase.com. Ask your eye care professional if this device may be right for you. Another application device for scleral lenses is marketed by Dulce Adaptive and again can be found online. This device allows you to use both hands to hold your lids apart while the device holds the application tool. This device is available both with and without a fixation light. Holding your eye open with a firm grip and keeping it open as the solution makes contact with the surface of the eye is essential for proper application of your scleral lens. It is a natural reaction to close your eye when the solution touches the cornea. With practice, your eye will become accustomed to this feeling and you will be able to keep your eye open. Remember, it takes practice and patience. Now let's talk about lens removal. Most patients will use a DMV removal tool to remove the scleral lens from the eye. After applying a small amount of moisture to the removal tool, apply the device flush with the curved front surface of your lens. The lens can be easily removed from the eye if the lids are wider than the diameter of the lens. Notice the image of the eye in the top right portion of this slide. The upper lid is covering the top portion of the lens. With the upper lid in this position, the lens will not come off the eye as easily as it would if the upper lid was lifted higher. Prior to using the removal tool, it is often best to use the lids to break any suction that has developed during the course of wear. Never apply the removal tool to the center of the lens. If the tool is applied to the central portion of the lens, a great deal of suction and resistance will be experienced. Remember, first break the seal, apply moisture to the removal tool, keep the lids wider than the diameter of the lens, then apply the device close to the edge. One useful technique for easy scleral lens removal is to apply pressure outside of the lens diameter onto the white portion of the eye with the lid. By temporarily flattening the white of the eye, an air bubble under the lens will result, thus breaking the negative pressure seal, allowing the lens to be easily removed from the eye. One other removal technique is referred to as scissoring the lens. With pressure, the lid margin, either the upper or lower lid, can be moved behind the lens edge, thus allowing the lens to dislodge from the eye without the aid of a removal device. This may come in handy if your lens needs to be removed and you do not have access to a removal tool. Again, it does take some practice, so be patient with yourself as you attempt this technique. All contact lenses require proper care and handling. Scleral lenses are no exception. In general, scleral lenses require a cleaner, a rinsing solution, and a disinfection solution. Always follow the specific directions and care system recommendations given to you by your eye care professional. In some cases, your eye care professional may adjust your care system due to any symptoms you may be having and/or findings he or she may see during the course of your follow-up care. Don't forget to clean and disinfect your application and removal tools along with lens storage cases. These rubber tools cannot be scalded similar to your storage cases. Most eye care professionals advocate the tools be wiped out with an alcohol wipe routinely and to replace these tools frequently, as they are a potential source of bacteria that may lead to an eye infection. Ask your eye care professional for specific guidelines as to the care and replacement frequency of any of the devices you may be using with your scleral lenses. Remember to always follow the specific directions and recommendations of your eye care professional. Learning to clean and properly handle your scleral lenses is essential to your success. Your ability to properly apply your lenses full of unpreserved solution is of paramount importance to be able to see clearly and be comfortable while you wear your lenses. Remember, if an air bubble is present when you apply your lens, remove the lens, refill the bowl of the lens, and reapply, as this application bubble will not resolve with lens wear. Although you may apply a clean lens, during your wearing period, it may become dirty, resulting in foggy or cloudy vision. This can occur due to your specific tear film osmolarity or even makeup that accumulates between the eye and the lens, or a number of other causes. Sometimes you may simply have to remove your lens, refill, and reapply to relieve this symptom. Always report any of your concerns related to your eyes and your scleral lenses to your eye care professional. We at XL Specialty Contacts hope that you have found the information in this presentation helpful. We wish you the best of luck with your scleral lenses as we seek to change the lives of our patients and their quality of life through better vision.